Hi, everyone. This is Professor Widener. I wanted to go over the research grid with you. This document can be a little intimidating, but it's actually meant to help you organize yourself as you do your searching for articles and developing your PICO question throughout the semester. My suggestion would be that you download the document and keep working on it as a Word document in your computer, so that way at the end of the semester, you can just download it and submit it. By the end of the semester, you should have it totally filled in. So when the time comes to submit it, that's really the last step. You have it all done and it's not due till the very end of the semester. But I actually got the idea for this from one of my classes that I'm taking for my PhD. It really helped keep track of my articles and figure out a plan and give me kind of a guide as to how I was going to do this. So in the first part, you're going to identify an issue or a quality improvement project related to primary care. So I want you to take off your RN hat and put on your nurse practitioner hats. Think about what you see in clinical or anything you may see that needs improvement within the primary care offices. You may even want to talk to the providers you're working with. Then you're going to develop a question following and around that topic. So for instance, someone last semester talked about increasing compliance with colonoscopy screening. So she researched ways to do that. And then her plan is to implement a project within the primary care setting to increase the compliance of colonoscopy screenings. So the one thing you have to make sure about is that this is a measurable topic. So it needs to be concrete, and it needs to be able to have an answer given it, especially for those of you who are working on your DMP, and we'll refine these over the next couple weeks. But so after you kind of develop the area that you're interested in, PICO is actually the way you're going to formulate and write your question out. P is for the population, I is for the anticipated intervention, C is for the comparison group or the current standard of care, which is what a lot of you will utilize. And O is the outcome. So that's the way you're going to formulate that. And right in here, you can type up all different kinds of areas just that you're thinking about. And then maybe with the help of your preceptor, you can kind of narrow something down. So, and we're going to work on developing those your questions over the next couple of weeks. So the next step is, once you identify a question, you're going to need to figure out where you're going to look for information as to how to figure out what research is out there about your PICO question. Because remember, in the class we're taking as MSN and DMP prepared nurses, we're focusing on research that has already been done by other people. So for instance, a nurse who has a PhD will generate new research. You're going to use research that has already been developed and apply that to the practice or setting wherever you work. So you're going to be implementing plans based on what's already out there. So you're going to, in the next spot, you're going to talk about the databases, the websites, and the professional organizations or research as to where you could get information to help solve this question. So when you think about databases, you can think about the CDC. You can think about looking at the library resources, where you can go and what databases you can use from there, and think about the different websites wherever you could go. Like diabetes has a big website. Patients with COPD have websites with lots of information. And then you're also going to go to where you can do research or professional organizations. The American Diabetes Association, for instance, they have a lot of organizations. There'll be something related to whatever your topic is. And if you can't find it, just go to Google and put it in, and I'm sure some things will come up. So just write, and again, this is all like thoughts and filling it in just as a way to guide your thinking as to how you're going to get to where you need to be. The next step is, what terms and limits will you use? So for instance, we know that our project our articles should be no more than 5 years old, or they can be older than 5 years if they're gold standard or landmark articles. So your exclusion criteria might be anything older than 5 years. Your inclusion criteria could be anything that's peer-reviewed journals, which is what we should be using for our evidence. And then key phrases could be anything you need to, again, based on your topic, whatever that is. And then in the literature search, you're going to be looking for some articles about this and different, we're going to go through the different articles that you need. But by the end of this, you're going to have an RCT, you will also need a systematic review, which is where there are a bunch of articles all reviewed and compiled into one topic. It'll be obviously about the topic that you pick. If you can't find one of those, we will accept another RCT to go with that. And that's a random control trial. And we're going to do all this. This is really just to give you some insight as to where you're going to go. And then the last thing we're going to do is we're going to find clinical guidelines related to whatever your question is. So in the literature search, this is a place, again, where you can go back when you're writing your papers, and you will use this information when you write your capstone or move on to your DNP projects. So under citation, I would put the APA citation for that. And then you want to write down any main findings that the article gives you. You also want to tell them what kind of research it was and the level of evidence. And we're going to talk about all those things. Usually articles will talk about the strengths and weaknesses of those articles, so you can write them there. And it can also be things that strengths and weaknesses that you notice within the article. And we're going to learn how to review articles for their strengths and weaknesses. And the last thing is, how does this article support your PICOT? It may not support your PICOT at all, so then you can just write, won't work for this reason. If you write that it does support your PICOT, then you can again write that it supports that. And you can add more lines to this, but again, I think keeping it in a Word document and filling it as you go makes it kind of a fluid live document that you can fill out. And again, it's not due till the end of the semester, but if you have any questions, please don't hesitate to ask me. But I think you'll find it very helpful.